Welcome to Breakfast with Spaniels with Dr. Judy Morgan. Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Good morning. So, I figured my day can only get better from here because I started out by falling down the stairs on top of Millie at, 5:30 this morning. One of those things when you hear the you hear the dog leaving the bedroom and heading down the hall, and you get up and run really fast. And Hugh and I keep saying these stairs are gonna just do us in, and man, and I guess the good news is Millie broke my fall. And the really good news is she didn't bite me when she turned around to see what the heck had just happened to her. And then I went to get dressed and pulled on my jeans, which were laying over a stool in the closet, and Hugh walks in the room. I said, "I smell cat pee. Do you smell cat pee?" He said, "No." I said, "Oh, I'm wearing it." So, had to change that. So, it's going to get better from here. However, right after breakfast with Spaniels, we are headed out to the barn because my horse is still not eating. And the vet was out yesterday. The vet was out Sunday. No, was she out there yesterday? No, she was not there yesterday. She was there Sunday and Monday. Anyway, we're going back out this morning. I didn't get to see him yesterday because he had been put out in the field when we got there. I was going to draw blood, but so we'll get out there. They're going to leave him in this morning so I can draw blood, but he still wants no part of eating. We're calling the equine dentist to come out and see if maybe he's got a cracked tooth or, some pain in his mouth that might be keeping him from drinking, which is then causing the secondary dehydration. So, I don't know. We're kind of trying to look for anything at this point. So I need a big cup of coffee. Yeah, well, this is the first, and it's half gone, and there will be more, believe me.
You didn't even sleep last night.
Huh?
You didn't even sleep last night.
I didn't sleep last night?
Yeah, you were awake.
Oh, yeah, well, no, I didn't wake up till 4 o'clock. I was good. I slept till 4. So, yeah, it'll get better from here. It's all good from here. Jeez. All right, so somebody had sent me an email. Yeah, glad I'm okay. Well, I'll let you know tomorrow. I think it's one of those things, like you do that slip, slide, flail, and I skinned my knee. And then I think a day later you kind of go, oh, that muscle. Oh, yeah, that one too. So we will see. I'm going to try to hit the gym today. Maybe I can stretch it all out. So somebody sent me an email and said that a friend, I think it was a friend of theirs, had their dog diagnosed with Horner syndrome, and she had never heard of it and didn't know that it could happen in dogs. I hope the sound is okay. This thing is not where I want it. So I thought I would talk about it. So Horner syndrome is a name given basically to paralysis on one side of the face. I think we talked about this a little bit when we discovered that George had the one side of his face drawn back and up. But his is not Horner syndrome. So with Horner syndrome, they can't blink the eye, and they usually have a droop on the side of the face. So the lower eyelid might hang down, and the lower lip will hang down. And so food will sometimes, depending on how bad it is, food will fall out of the mouth on that side because they really have no feeling on the side of their face. So when you tap their eye, they don't blink. And if you poke them on the side of the face, they don't feel that, and food falls out because the lips don't work on that side. So I see it really, really commonly actually in certain breeds. So it is definitely more common in Cocker Spaniels, fairly common in Cavaliers, and I see it in Golden Retrievers a lot. And there's a couple things that can cause it, and there's a couple things that it can be confused with. So another thing that could cause some paralysis, pain, inability to open the mouth correctly is eosinophilic myositis, and that's actually an inflammatory, kind of an autoimmune reaction where the body is attacking the muscles of the head, and with that you'll get the muscles will shrink away, so it looks like you're seeing the skull with just skin on it and no muscle. We can get that muscle atrophy as well if the facial paralysis from Horner syndrome goes on long enough. So the Horner syndrome can be caused by multiple things. Very commonly, it can be trauma to the head and hitting the nerves that supply the side of the face. Tick-borne diseases, particularly Lyme disease, can be a cause of facial paralysis. There is a lot of talk. It's similar to Bell's palsy, actually. We just don't call it that in dogs. So we can see it with Lyme disease. We can see it secondary, or at least there's a theory that it can be secondary to rabies vaccination. And there's a theory that the eosinophilic myositis is also secondary to rabies vaccination. Because that vaccine, let's remember how rabies works. Rabies is a virus that travels along the nerves and then makes its way up to the brain. So, nerve damage to the side of the face or to the muscles that supply the face could potentially be secondary to that. Nobody really knows. Most of the time when we see the Horner syndrome, it's what we call idiopathic, meaning we have no idea what caused it. The good news is I've had really good success treating facial paralysis. Sometimes it'll just clear up on its own, which is really nice. I wish George's would clear up on its own. I think his is actually getting worse. He seems to be smiling more on that side, and that ear is higher than the other one. And I don't want to put him on steroids, so we're just going to let it do what it's doing. So traditional veterinarians are going to treat Horner syndrome generally. I cannot talk today. When I fell down the stairs, I must have affected my brain and my mouth. So traditional veterinarians are going to treat it with anti-inflammatories. So you might get non-steroidals like Rimadyl or Metacam or Deramax, something like that. Or they'll treat it with steroids. You can't use both together. They don't play well together. But that's typically what is done. I don't actually find, for the eosinophilic myositis, that will help, but for the Horner syndrome, it generally doesn't make a big difference. The best success that I've had is using electroacupuncture. So we'll put acupuncture needles around the eye, on the side of the face, around the lips, sometimes down into the neck, and put electrodes across and do electrostimulation. And I found that that can be very helpful. We usually have to do it weekly for quite a few, maybe 4 to 6 weeks. And then we have some herbs. There's a great herb made by Jing Tang that's called facial pea. And it works pretty well. So the combination between the acupuncture and the herbs seems to do a good job with these guys. Yeah, it might be what your cocker had, no blinking facial paralysis. So I wonder, in the cockers in particular, is this coming from a lot of that inner ear infection and, inflammation that they so commonly have? So if you have a cocker that has, so I'm thinking of a little cocker that, a little buff cocker that came in my office, and she had facial paralysis on one side, and then she had facial paralysis on the other side months later. But she also had really bad ears and had ear canal ablation done. So kind of like scalp. So not a big surprise. There's so much nerve damage done with those surgeries. And I'm kind of surprised Scout didn't really suffer with that, with everything else that he went through. There's still time, Scout. So we have had fairly good luck treating it. The good news is most dogs, it's not so severe that they can't live with it. even if it doesn't go away. The biggest problem that you have, I mean, yes, they might drop some food out on one side and they might get some, lip fold infections where they're not able to clean up that side of their face. The bigger problem is that with them not being able to blink, the eye can get dry. So, if it doesn't get better at all, then you need to be putting drops in the eye, the Genteel or the Refresh drops to keep the eye lubricated. Georgie doesn't close his eye all the way, but it really, the dryness hasn't been a big issue with him. We put drops in sometimes when I think they look dry, but he hasn't needed them lately. So, oh man, like the spring teaser. Yeah, I like the spring teaser. I'm going to try to get outside a little bit today. It's supposed to be like 75 degrees. All right, so what else did I miss here today? Speaking of dental, cat and dog are getting a dental cleaning. I was wondering if anti-inflammatory or antibiotics are necessary. So that kind of depends. We use antibiotics if they have really bad teeth with a lot of infection, deep pockets, a lot of periodontal disease, or if they have a bunch of extractions. So for the dogs whose mouth isn't so bad, or cats, if their mouth isn't so bad and the only teeth that we take out are like the little incisors that are already just so loose, we just pop them out, then we don't need all that stuff. If your veterinarian has cold laser, that's a really good thing to use at the end of the dental procedure. So they can actually set it on a post-surgical or a contaminated wound setting. And, if there is a lot of periodontal disease, bacteria and stuff in there, they can use that laser. That'll kill an awful lot of the bacteria after the dental is done. And so that might shorten the course of antibiotics that are needed. So, no, we don't send antibiotics or pain meds with every single animal. It just really depends. I mean, if we're digging out deep roots and, we're splitting teeth and, we've got some trauma going on in the mouth, then we will send home pain meds. And there are herbals you can use. You can use the doggone pain herbal. You can use arnica. There's a lot of things you can use instead of having to go to the NSAIDs or that sort of thing. So, had a golden with immune-mediated masticatory myositis showed up after a combination shot. Yeah, and the problem is we don't really know. Stroke-related, yeah, maybe, but not so much. We don't really know. And the problem with the rabies vaccine is that veterinarians don't like to say that something caused something unless it's an immediate reaction. So if you gave the vaccine today and the dog was paralyzed within 6 hours, they'd go, oh, that might possibly, maybe. But when it happens 3 months later, they're like, oh, no, there can't be any association. Well, these things move slowly. So I think there can be an association. I love cold laser, works wonders. Used it after bladder stone removal. Yeah, it's really good for just so many things. 8-year-old boxer with a weak bladder. We let her go out often, but accidents happen. Oh, there are so many things, Dewey, that can help that. I've got a couple blogs on that. If you go to my website and just in the search box up top, look up urinary incontinence, I think you'll find some. Probably warming foods. Depends how. What'd she say? It was an 8-year-old boxer. Yeah, it might be a cold dog. So yeah, there's information on that. Okay, we got to get to the barn, and actually we haven't even fed the dogs yet. Okay, we got to feed the dogs, then we got to get to the barn and check on the big spaniel. Hopefully the horse dentist is coming today. Another fun day. Yeah. I think I have 2 interviews today. Actually, I'm being interviewed on somebody else's radio show today. Marianne Jacobs, the answer to that is they should be able to. Take care of myself. Yeah, I'll try not to fall down the steps a second time today. Wasn't much fun. I think I need to put my glasses on when I get up in the morning. Yeah, coming down the stairs in the dark, no glasses, barefoot. It's a slip slide. Hi, is this Breakfast with Kitties? Do you want your own show? We might have to make our own kitty show. Huh? Oh, Hugh says she has her grumpy face on. I think she wears it most of the time.